Hi, I'm Carrie Elizabeth Lynn. I'm a licensed professional counselor and I also have bipolar disorder myself. Today I'll be talking about the difference between bipolar disorder and major depressive disorder. Major depressive disorder, or MDD, is also sometimes called unipolar depression. I'm not going to go over all the criteria for MDD. I'll just explain the main differences between it and bipolar disorder. I want to help clear up the differences between bipolar disorder and illnesses that are very close. So in this video, I'll talk about MDD, and in my next one, I'll talk about schizoaffective disorder. In 3 previous videos in this series, I described manic episodes, hypomanic episodes, and depressive episodes. So for a diagnosis of MDD, you have to have had at least one depressive episode. And you cannot have had any manic episodes or hypomanic episodes. In other words, like bipolar disorder, MDD also involves mood episodes, but it only involves depressive episodes. I often hear people say they have depression, meaning MDD, and bipolar disorder, but by definition, you either have one or the other. If you're diagnosed with MDD and you later have a manic or hypomanic episode, the diagnosis is changed to bipolar 1 or 2, and the MDD diagnosis is dropped. So that seems pretty clear-cut. If you've experienced a depressive episode but not a manic or hypomanic episode, you have MDD. And if you've experienced a manic episode in the case of bipolar 1, or a depressive and a hypomanic episode in the case of bipolar 2, you have bipolar disorder. However, in practice, it can actually be hard to distinguish MDD from bipolar disorder. Because of that, there's a lot of misdiagnosis, which can lead to inappropriate and ineffective treatment. In some cases, people with bipolar disorder are mistakenly given an MDD diagnosis. In fact, it's very common for people with bipolar disorder to initially be diagnosed with MDD. This is especially likely when someone sees their family doctor rather than a specialist. Why does this happen? Well, people usually seek treatment when they're depressed. And without a thorough assessment, a provider is likely to come to the conclusion that a patient who's depressed has MDD rather than bipolar disorder. It can be very difficult to detect past hypomanic episodes, so this is especially likely to happen when someone has bipolar 2. Of course, some people who come for treatment for depression have never had a manic or hypomanic episode. But even then, an experienced provider will be mindful of the fact that they might have one eventually, and they can also use other information to estimate the likelihood that someone has bipolar disorder. In other cases, people with MDD are wrongly given a bipolar disorder diagnosis. This can happen for a number of reasons. For example, let's say someone comes for help because they're depressed, and they say they sometimes have mood swings. And let's say that person also has a close relative with bipolar disorder. Well, the provider might jump to the conclusion that the patient has bipolar disorder based on that information without getting more details. It may be that the upswings aren't long enough, severe enough, or unusual enough to qualify as a manic or hypomanic episode, and that the patient actually has MDD. The bottom line is that it can be difficult to tell the difference between MDD and bipolar disorder, and it's important to get an accurate diagnosis so that you get the most effective treatment possible. Unfortunately, there's not yet a blood or other physiological test you can take to determine your diagnosis. So the best way to get an accurate one is to consult with an experienced mental health specialist, such as a psychiatrist. They should take a thorough and accurate medical and family history, which will involve asking you lots of questions, preferably using a structured interview. They may also give you tests or assessments to fill out and interview family members or others who know you well. So that's the difference between bipolar disorder and major depressive disorder. The two illnesses can look very similar, and to get an accurate diagnosis, it's important to seek professional help. Thanks for watching, and here's to good mental health.